Namaste everyone, I am Dr. Amit here. Hope you all are doing great. Welcome back to my YouTube channel at the rate Dr. Amit Official, where we make medical concepts simple and practical. So if you haven't subscribed yet, don't forget to hit the subscribe button and stay updated with all our videos from all subjects of MBBS. In our last video, we covered the topic hyperammonemia from our biochemistry series. Today we are moving to an important clinical topic called ornithine transcarbamylase deficiency. It's an enzyme used in urea cycle. So this is a must-know topic for your NMCLE exam, for your USMLE Step 1 exam, postgraduate entrance exam, and MBBS professional exams. So I'll break it down in a simple, clear, and exam-oriented way for you. So stay with me and let's get started with our today's topic, ornithine transcarbamylase deficiency. And don't forget to subscribe my YouTube channel at the rate Dr. Amit Official. So we are starting our topic, this ornithine transcarbamylase deficiency. Okay. So before starting our topic, I've already made the video on urea cycle previously. Okay. So in the last video of the urea cycle, okay, we all know that this enzyme ornithine transcarbamylase, actually this had been used over here to convert ornithine into citrulline. Okay, and this carbamoyl phosphate is also being used in this step. Okay, so this enzyme is actually deficient, then what will happen? Okay, so we are talking about this enzyme. Okay, so while talking about on this topic, okay, first remember that most common urea cycle disorder, okay, most common, now it is a genetic disorder. Okay, because this enzyme is absent or deficient in genetically. Okay, so a genetic disorder of urea cycle in which ammonia cannot properly convert it to urea because that enzyme is deficient. Okay, so what will happen now? So if this enzyme, okay, suppose if this enzyme is absent, then the process will not occur further. Okay, it means the process will stop over here, then the ammonia will accumulate in the body and it will cause again what? Hyperammonemia like conditions. So increased ammonia in blood. We also talked about this, that one of the cause of hyperammonemia in the last lecture. Okay, now it's a X-linked recessive. Always remember, this enzyme deficiency is only X-linked recessive. Others are all are autosomal recessive, but this is a X-linked recessive. Okay, now this deficiency mainly, not only, okay, mainly affect male, but sometimes females also get affected, and that will be a milder form. Okay, so for clue, okay, so for clue in the USMLE exams, okay, you can get questions like a newborn male, poor feeding, vomiting, and have neurological symptoms. So always think once about this ornithine transcarbamylase deficiency. So this is a clue, okay, in the USMLE exam, in any entrance exam or NMCL exam. So this is all. Okay, now often evident in the first few days of life. Okay, so the symptoms usually come within first few days of life but may present later also. Okay, now what's the normal function of this ornithine transcarbamylase? Okay, so normally what it do, convert ornithine into citrulline with the help of carbamoyl phosphate. So carbamoyl phosphate and ornithine transcarbamylase both mix together, okay, come together. So when we see in this cycle, this ornithine transcarbamylase actually converting ornithine into citrulline, yes, with the help of carbamoyl phosphate. Okay, so this is a normal function. Okay, now if this step is blocked, okay, suppose if this step is blocked, then carbamoyl phosphate, this carbamoyl phosphate will accumulate because it will not lead further, and this ammonia will also accumulate in the body. Okay, so the urea cycle cannot move further and this carbamoyl phosphate will accumulate. Now two things happen. Okay, what are the two things? One, ammonia accumulates, another is carbamoyl phosphate. So if ammonia accumulates, that will cause toxicity, because we all know that ammonia is a neurotoxic, and this carbamoyl phosphate will enter a pyrimidine pathway, okay, and make orotic acid. Okay, so if this enzyme ornithine transcarbamylase is deficient, then another one thing is we'll get orotic acid increase in our body. So what will be the lab finding in those patients? So in lab finding, we'll find orotic acid in blood and urine. So in blood also and in urine sample also, we'll find orotic acid. Okay, increase lab value. Then decrease blood urea nitrogen. Why? Because the ammonia is not entering into the urea cycle, so no urea formation, so blood urea nitrogen is decreasing. And now symptoms of hyperammonemia, because ammonia is getting accumulated in the body. So we all know what are the symptoms of hyperammonemia. That is a flapping tremors, then slurring of speech, somnolence, vomiting, and cerebral edema. So we all learned how these symptoms occur in the previous video. Now, one important code, we most often we get confused from one disease is orotic aciduria. Okay, so this orotic aciduria and ornithine transcarbamylase is actually different. Okay, but in orotic aciduria, okay, we also we get the level of ammonia normal and blood urea nitrogen normal. But in case of ornithine transcarbamylase deficiency, there will be increased ammonia level, okay, hyperammonemia, and blood urea nitrogen is low. Okay, and one main difference between orotic aciduria and this disease, ornithine transcarbamylase, is no megaloblastic anemia. Megaloblastic anemia is present in orotic aciduria, but not in this disease. Okay, always remember. Sometimes the examiner will make you confused in the options that whether this is orotic aciduria or it is ornithine transcarbamylase deficiency. Now, coming to treatment part of OTC deficiency, we should restrict protein in the diet of the patient, and in severe cases we'll do dialysis. Okay, so if you get a question like a newborn male with poor feeding, vomiting, and have neurological symptoms like these all symptoms, okay, and have decreased blood urea nitrogen and increased orotic acid in blood and urine, okay, and the patient has no megaloblastic anemia, okay, something like that, then always think of ornithine transcarbamylase deficiency. But if they will give all the symptoms, okay, but if they will say the ammonia level is normal, blood urea nitrogen is normal, okay, and the patient have megaloblastic anemia, then think of orotic aciduria. Okay, so this is all about this ornithine transcarbamylase deficiency, one important enzyme in urea cycle, and most often the questions asked in most of the entrance exam and highly competitive exams. Okay, so don't forget to read all these steps, okay, and the symptoms. So if you like this video, please share this video with your fellow medicals and your medical college group, okay, and do subscribe to my YouTube channel at the rate Dr. Amit Official, and stay tuned and keep work harding. We'll meet in the next video on a very important topic. Till then, bye and take care.